On to Chapter 3 for the midterm review. The key aspects of Chapter 3 that I want you to know are the mechanical and chemical functions of the digestive tract. And let's start with the mouth. We know that in the mouth there is chewing and crushing that happens, and this is where mechanical digestion begins, but also chemical digestion. We do have saliva and enzymes within the saliva that start to digest starch. So carbohydrate digestion begins in the mouth. Now, as the food goes down the esophagus into the stomach, this is where the stomach grinds and churns. It turns the contents of the stomach into a chyme. It's almost like a paste-like substance. The cells of the stomach release hydrochloric acid. This is going to drop the pH, so it's very acidic. And the reason this happens is mainly to digest protein. So remember, we talked about the protein being a very complex structure, and it's losing its shape. It basically, it's very twisted, and it unravels and unfolds in the stomach, and that's because of the low pH. So protein digestion happens in the stomach, that first phase of it. Very important. That's why we have the low pH. Okay, so the low pH is going to uncoil the proteins. Now, mucus is released from the cells in the stomach, and what that does is helps protect the stomach cells. So the stomach cells don't burn, essentially, don't burn from the low pH. So moving on to the small intestines, this is where digestion and absorption happen. This is the main organ. These are the small intestines here. This is the main organ of digestion and absorption. This is where most of the breakdown of the nutrients happen and the absorption of nutrients happen, mostly in the intestines. The intestinal cells also release enzymes to help with the breakdown of food into its component nutrients, and then allow for those nutrients to be absorbed into the bloodstream. The pancreas does many things, but as far as digestion is concerned, it releases carbohydrate digesting enzymes, protein digesting enzymes, and fat digesting enzymes. You don't need to know the names of these, but the pancreas, and that's the pancreas's role in digestion and absorption. So we can't have an enzyme essentially is going to, in this role, is going to break that food particle, the food down into its individual nutrients. You can't get that absorbed into the bloodstream until that happens. The liver. The liver mainly makes bile. Now, for at least as far as digestion and absorption are concerned. Remember, the liver has a lot of other functions. It's one of the, we think of it as the detoxifier. It's the main place that nutrients, food components, all of the compounds in our body are metabolized. But as far as digestion is concerned, it produces bile. Now, the gallbladder is going to store bile and store it and release it. So this is the liver here, and in this tiny little green area here, that's the gallbladder. It's a storage sac. So the liver is going to make the bile, the gallbladder stores it, and then releases it when food components go into the small intestines. So as soon as food enters, particularly fat, enters the small intestines, the gallbladder is triggered to release bile. Lastly is the colon. So here's the colon. This is kind of this, I don't want to say it's a storage depot, but once everything has gone through, we try to pull out as many nutrients as possible into our body that we need. The remaining parts end up in the colon, and the colon is going to pull out water, it's going to pull out minerals, and there are a lot of bacteria in there, so some of the fiber fragments are digested or broken down, and we might pull a few of those fragments into the body, and the rest is going to travel around, becoming more compacted, I should say, all the way down through here and before it's excreted. So absorbs water, absorbs minerals, and some fiber is digested. So the storage systems in the body, we think about the liver. Now, what does the liver store? Think about that for just a minute. And think about what the muscle stores. And then we know that the fat cells, almost everything is going to end up as fat. So the liver, muscle, and fat are our storage systems. But I want you to think about what each one stores, because you'll need to know this for the exam. So we think of starch. This is, mostly our carbohydrates broken down into glucose. Sorry, that's a little hard to read. And then once it's absorbed, it's stored as glycogen in the liver and muscle, and that's what I wanted you to think about. Both the liver and muscle store glycogen. Glycogen is our storage form of carbohydrates. Basically, it's a link of glucose. Now, if you need that glucose for energy, you'll use it. If you don't, you store it as glycogen in the liver and muscle, and if you continue to eat too much and those glycogen stores are full, it ends up in the fat cells. So what about fat? Well, we start with eating fat. Fat is broken down into fatty acids, right? That's how they are absorbed into our system. And then if they're not used for energy, they get stored in the fat cells. And lastly, we have protein. So if we consume protein, protein's broken down into amino acids. That's how they are absorbed into our bloodstream, right? There's a lot of functions. So they're not, but amino acids are not stored. Remember, there is a small amino acid pool that the body can draw from, but protein is not stored to a large extent in the body. And if you can eat too much protein, it will also be stored as fat. We don't want to store it as fat or use it as energy, but it can. So what's the moral of the story? Anything you eat in excess will be stored as fat. So our excretory system. The lungs is going to, what is this going to excrete? It's going to excrete vapor, right? What is that? That's a fluid loss. We also have the liver. That's another excretory system. And then the kidneys. We always think about the urine. So the liver can excrete products that end up in the digestive tracts, particularly the small intestines to the colon, and then the kidney products will end up in, or compounds will end up in the urine. Heartburn, and I apologize, these are a little bit difficult to read. Heartburn is, we think about it, you have this, burning right in this sensation. That's why they call it heartburn, but it's that acidic contents of the stomach which end up coming back up into the esophagus. The esophagus doesn't have the mucus lining that the stomach does to protect itself. So there's a burning sensation, and usually occurs just below the sternum. So in order to treat this, or to give advice to people with heartburn, you want to tell them to decrease the contents of their stomach. So decreasing the amount of fluids they drink with a meal. So you want to drink either before or after a meal. Now, limiting fiber at one time is important. So you don't want to eat hugely fibrous foods in large quantities all at once. It should be divided out, because remember, fiber provides bulk. It's going to expand in the stomach. So that's going to increase the amount of space and maybe shoot those contents up from the stomach into the small intestines. Smaller meals more frequently. And wearing loose clothing. This wouldn't seem, it seems logical once you think about it, but you wouldn't think of it. But if you have something that's really tight around your stomach and it's squeezing in on the stomach, what's going to happen? Those contents are going to go somewhere. And if they can, they'll go right into the esophagus, bringing that acidic contents of the stomach into the esophagus. And then think about what gravity does. Gravity wants to pull everything down. So if someone lies down right after eating, everything's going to have a tendency to move into the esophagus, or a greater chance. So either sitting propped up afterwards, if going to bed after eating, or just eating, at least an hour, maybe 2 before going to bed. Lastly, remember we had a discussion on alcohol, and that there are positive and negative effects of alcohol. I want you to know both. We'll start with the positive, and remember, this is in moderation, and moderation you have to know the definition of, because that's key. Moderation is 1 drink per day for a woman and 2 drinks per day, a max, for a man. This is important because many people think, well, if I'm having a few drinks, 2 to 3, or 7 drinks a week, so if I have them all on Saturday night, that's okay. And that is not the case. That is not moderate drinking. So what does a little bit of alcohol do? Well, it can increase the appetite in the elderly. It can provide some phytochemicals, particularly we think of resveratrol. I have to say we're getting some questioning about its effect now with some recent studies that have come out, but it's been fairly well established. We'll see where that research goes in the future. And then the alcohol itself can inhibit blood clotting. And why is that important? Remember that blood, when it's clots or it's clumpy or it's thick, that's going to increase the risk of heart disease and stroke. So what are the negative impacts? Well, this is only a very, very small list of the negative impacts. And this is generally more in excess, but brain cell death, and this is just killing the neurons in the brain, dehydration. It inhibits B vitamin bioavailability, basically absorption and then assimilation in the body. It increases the risk of hypertension as well as inflammation. And that's it for Chapter 3.